Hey everybody, so I wanted to just talk about Medicare.gov and the resources that Medicare.gov has. Medicare.gov actually has a whole bunch of new tools and things, and if you haven't gone recently, I would definitely go and check it out, especially on the basic side. So they've made everything really simple. When to sign up, how to sign up, when coverage starts, everything here. Working past 65, it has become far easier to get any kind of information that you want for people who are new to Medicare. I would familiarize yourself with all of these steps and all the different kind of categories in each side, especially when it comes to when does Medicare coverage start. So many of you may or not know, but currently, until they changed the law, I believe the law went into Congress and should pass unless something strange happens, where the month you sign up for Medicare, your Medicare will start the month later. That law still has not been taken into effect yet. So if you have someone who starts Medicare because they're 65 or is going to enroll in Medicare because they're 65 and they sign up 1 month after you turn 65, then your coverage starts 2 months after you sign up. So if someone's birthday is in July and they sign up now in August, they will get their Medicare Part A and B to start, yes, in October. Okay? And again, if they sign up even later, if their birthday again is back in July and they signed up in either September or October, that's still okay, but their coverage will not begin until 3 months after they signed up. Now, how do you avoid this weirdness? Well, you have to use the SEP when they sign up, not the IEP when they sign up. So it's nothing to do with Medicare Part D, Medicare Part C, or Medicare Supplement. This has everything to do with the way that the individual signs up for Medicare, right? So when to sign up. So you can find that all here, okay? And then all the forms are here as well. But I want all of us to be very familiar with this, especially because this is from Medicare.gov, and this is probably what those wonderful people who pick up the phones and operate at the Social Security office utilize. And if anything on here is contested by the people who work at Social Security, we're able to just kind of say, hey, this is what you guys did right here. This is how we're going to do it. So familiarize yourself with Medicare.gov, especially when it comes to, when you get there, the basics. Getting started with Medicare, Medicare costs, your Medicare rights. You don't really need to know too much about fraud and abuse. I'll go into that later when it comes to kind of like what I'm currently working on in addition to all of this stuff. So just make sure that you guys at least understand these. That's for first three here. This end-stage renal disease, as well as ALS, that's the Lou Gehrig's disease. I think it's I don't even know really what ALS stands for. Some kind of sclerosis, I think. But basically, it's saying that you are eligible for Medicare as long as these things are met. They still have to apply. So they still will need to go and apply for, Medicare, even if they have end stage, even if they meet these, because technically, if you're still working and you still have to go and do these things, because there are people who are still working and they don't have working kidneys, the rules for Medicare when it comes to group insurance is really gray. I talked about this a little bit back about how there was a case, I forget which state it was, where the health plan refused to cover dialysis treatment for someone who had end-stage renal disease simply because they should have been qualified for Medicare based on Medicare's qualifications. So the patient should have actually signed up, or the employee should have actually signed up for Medicare, not burden the group plan on paying for it. And so there's something that you might want to verse yourself in if you have people that ask. To be honest, I would direct those folks who ask about end-stage renal disease or any other qualification for Medicare aside from the turning 65 or 65 and over losing work coverage. Anybody else, I would have them contact Social Security and have them fill you in the loop, because many times these circumstances will need to be verified, and I don't even know what Social Security requires or Medicare requires now when it comes to verification on these things. Another thing to remember is it starts not directly after it. These, depending on the certain kind of progress or prognosis of end-stage renal disease, it can start later. As you can see here, there's a 4-month waiting period when you sign up for Medicare from when Medicare actually begins. So it's not automatic. They have to wait. And therefore, if they know they're going to lose their group plan, they have to apply for Medicare ASAP, because there's this waiting period. So just because they qualify via some kind of special circumstance like this, there are things within the current Medicare law that do not allow them to start right away if they are end-stage renal disease under the age of 65 and looking for medical coverage this way. Most likely in Hawaii, most likely if this was the case, they would default into Medicaid until Medicare picks them up. But for the most part, this is kind of the unfortunate route that we have to educate people on, is that it's not guaranteed, or it is guaranteed, it's not immediate. Yeah, so just be sure. And then Medicare can go away if they get a kidney transplant and they no longer, they will always have to take certain medications after getting a transplant, but sometimes you can go back to work and you don't need dialysis anymore. So their coverage could end, right? So if you stop dialysis 12 months after you stop dialysis, or 36 months after you had the kidney transplant, you're all good. Or meaning you're all good, meaning you won't have Medicare anymore, and you probably are expected to go back to work and such. And then when you're on Medicare due to a end-stage renal disease, you can actually get a Medicare Advantage plan. You are able to, or Medicare supplement plan. Most likely Medicare supplements will be more expensive. And of course, whatever is best for the client at this point, but it does kind of make it difficult, because end-stage renal disease used to be a disqualification for patients, but now even if you have end-stage renal, you can still get into a Medicare Advantage plan. So make sure if you do have someone that fits into this specific criteria, that you check the network and let them know that Medicare will only burden 80% of the costs. They still have to pay for 20% of the cost of the renal or the dialysis. And if they sign up for a Medicare Advantage or Medicare supplement plan, the cost will be a little different depending on the plan they sign up for. It might be better, might be worse. And of course, networks, right? So again, just check those out, because this is really good. They've really, I don't want to say fixed it, but they've made it a lot easier to navigate. And also just, make sure that when it comes to finding health and drug plans, you let them know, let your clients, let your prospects, let anyone who's talking to you know that while yes, Medicare.gov does have access to all the different plan types, just because one plan is cheaper than another or has more stars than the other isn't necessarily the end-all be-all in selection. That you yourself, as a Medicare agent, as someone who's done this for a while, someone who does this as a profession, has a little bit more insight that you can help them kind of hash out their their questions, hash out certain scenarios that many times people who do this, employment or are employed, don't really think about and don't really have to contend with, because when you sign up with Medicare.gov, you really have no agent. You really have no advocate for you that can help really navigate the plan, which is ultimately what we as agents strive to do. So remember that whenever you're talking to someone. I hope you guys all saw my video about how the new compliance rules for marketing and enrolling and talking and educating prospects about Medicare Part C and Part D plans would require us to record our calls and keep them for 10 years. Or was it 7 years? Whatever it says in the video. Make sure that when you have conversations with people, if you know you're going to meet them in person, try and reserve all the educational marketing plan reviews. Reserve that for in person. Medicare compliance wise does not require you to videotape or record your actual conversation, only if you do things over the phone. So if you are adamant about keeping things off the phone because you're meeting with them in person, that may be a way to get around having to record all your telephonic conversations. But if you want to keep recording or do things via telephonically, like I intend on doing, hopefully plan advisors and integrity marketing will have more training, or at least training on how to use Medicare Center. I honestly have no idea how we're going to do it. I have no idea what that technology plugging in is going to look like. But just know that that's going to be the new way. That's going to be how we do things, with the caveat of one thing, and this is kind of what I've been working on, is just educating my client. I've been doing this for Part D anyway. Educating my client on how to pick a Part D plan via my website. You can send the link over to your client and they can shop themselves. And really educating them on how to find the best plan based on what they have, without going into detail. Remember, Part D is a little bit different than Part C. Part D really only has two major parts of a sales presentation, right? You have to let them know about how the coverage gap works, and you have to let them know about the tier 1 to tier 5 pricing, teach them how to find their pharmacy, if it's in network, out of network, and then teach them how to use the formulary. Very simple, right? You don't have to worry about providers. You don't have to worry about reading through the summary benefits, because there really isn't one. It's small. It's just like one page talking about the pricing. So it's not that difficult. So I don't really have, I'm not really stressing that, to be honest. But for people who are having to enroll in Part C plans, especially D-SNP plans, there will be more scrutiny again. And like I said last year, if you're talking to someone and they're really unsure and they really don't know, and you kind of get that feeling that they're not going to sign up, or if they do sign up, they probably are going to, talk to another agent, talk to their friend, really put the scrutiny on you, just walk away. There's so many more people out there that you can help. There's so many more people out there that need your help. So don't stress on it. Anyway, you guys have a good weekend. I'll talk to you guys next week. Good luck on your tests if you haven't passed them yet. Do good things, and we'll see you later.